Hello friends. Now from this photograph you can observe the difference between the color in the fingers of same hand or of both the hands. So in one of the picture it is showing that the two fingers are different than other thing and the three fingers are different than other two. And in the second photograph these four fingers are different than the one and the total hand is different than the other hand. So what exactly it is? So in this diagram or the photograph, you can clearly observe the color of this finger. That may be a yellow one, and in this picture it is white. So if the fingers or the part of the fingers of your hand mostly or in other part, if it becomes white, it means it clearly indicates that the blood circulation is improper, and due to this the phenomena is called as Raynaud phenomena, that is also called as white finger disease. So this white finger disease or Raynaud's phenomena. So we will discuss what exactly this phenomena is, why it is causes, what are their adverse effects on our body or health, and how to reduce this effect or how to remove this effect. Is there any rules and regulations to reduce or to take care about this white fingers disease or the Raynaud's phenomena? So what is the Raynaud phenomena? So from this photograph just now we have observed the disease, it is a disorder of blood circulation. So this is mainly related to the blood circulation. So it is a disorder of blood circulation in the fingers and toes, and less commonly of the ears and nose. So mainly if the blood circulation is improper in the fingers and toes, then it is called as Raynaud's phenomena. So in the rare cases, it is the case with the ears and nose also. This condition is aggravated by the exposure to cold. So if your fingers or the toes are exposed to the cold or severe cold or to very less temperature, then it may occur. When a person has Raynaud's phenomena, exposure to cold abnormally reduces blood circulation, causing the skin to become pale, waxy white or purple. So the skin color may changes, it may become pale or waxy white or purple. But the main effect is it reduces the blood circulation in that part. Due to that, because that part or that fingers are connected to the cold exposure. The disorder is sometimes also called as white finger or wax finger or dead finger, because we feel that there is no sensation in that particular part or in that finger. That is why it is also called as dead finger, and due to the white color it is also called as white finger, and it may appear as a wax, and that is why it is also called as wax finger. So this is the basic concept what exactly the Raynaud's phenomena or the white finger disease is. So it is mainly related to the reduction of the blood circulation in that particular part. So Raynaud phenomena has many different causes including workplace exposures. Occupationally, it is most commonly associated with the hand-arm vibration syndrome. So it is mainly related to the hand-arm vibration syndrome, but it is also involved in other occupational diseases. So it is mainly related or affect on the hand arms due to the vibrations or due to the cold exposure. It is important to know that the signs and symptoms of this Raynaud's phenomena and the workplace hazards that cause it. So we must know whether the white finger diseases occur in your hand or in your fingers or not. So we must observe the signs and symptoms. Awareness can help prevent the disorder from occurring or progressing to a serious stage. Because in the initial stage, we can sense that this blood circulation is improper in a particular part. Then we can avoid the repetition of that work, or we can avoid the cold exposure of that fingers or of that hand on a continuous basis. So we can rub the hand, or we can go to the working environment where the temperature is more than the previous one, or we can avoid that vibrating machinery work for some times, and after some gap again you can continue the same. So we must know about this white fingers disease. That is nothing but the part of awareness, and if you are knowing about this white fingers disease, then you can avoid at an initial stage. If not detected in the early stages, the disorder can permanently impair blood circulation in the fingers. So that is the main reason why you should go to detect this disease, or you must know the signs and symptoms of this Raynaud's phenomena to avoid the permanent damage or permanent impairment of the blood circulation in the fingers. Although Raynaud's phenomena is not life-threatening, severe causes or severe cases cause disability and may force workers to leave their jobs. So if it is a permanent case, if it is a long-term case, then you may lose your job due to this impairment of blood circulation in the fingers. Because if your job is mainly related to the fingers, mainly related to the hands, then you may lose your job. Although rare, severe cases can lead to the breakdown of the skin and gangrene. So gangrene is normally occurred when there is a injury, and if you are not aware about this injury, then gangrene may happen. So that is nothing but the infection or continuous infection to your some part of your body or throughout your body. Sometimes the breakdown of the skin can happen due to this Raynaud's phenomena if it is a severe case and it is a rare case. Less severely affected workers sometimes have to change their social activities and work habits to avoid the attacks of white fingers. So if the white fingers phenomena or the Raynaud's phenomena is continuously occur in your fingers or in your hands or toes, then you have to avoid the similar type of work or the same type of work in the working environment or daily basis. So why Raynaud's phenomena occurs is not well understood, because many times we don't understand that this is the Raynaud's phenomena. Usually the body conserves heat by reducing the blood circulation to the extremities, particularly the hands and feet. This response uses the complex systems of nerves and muscles to control the blood flow through the smallest blood vessels in the skin. In people with Raynaud's phenomena, these control systems become too sensitive to cold and greatly reduces the blood flow in the fingers and the toe. And this is the complex systems of these muscles and nerves to control the specific blood flow throughout the systems, throughout the fingers, throughout the hands. And that is why generally the common persons are not going to understand this Raynaud phenomena. Blood flow can also be reduced by adrenaline that is released during the times of high stress or anxiety. If you are having some work stress or some other stresses due to the personal reasons or some anxiety, then also this blood flow is improper, or the impairment of blood flow can occur in the fingers or the toes or in other parts of the body. And that is why we can't understand whether it is a Raynaud's phenomena or whether it is a high stress or whether it is mental pressure, and due to this mental pressure this blood flow in circulation or blood flow circulation is improper. So that is why we can't understand the Raynaud's phenomena is occurring in our body. Tingling and slight loss of feeling or numbness in the fingers, toes, nose, lips, ears. So that is the common phenomena which is occurring in our body and which is mainly observed in the winter regions or when the temperature is very low. Then blanching or whitening of these fingers, usually without affecting the thumb, numb, prickly feeling or stinging pain, sometimes with redness upon warming or relief of stress. So if you are warming the fingers, warming the hands by shaking the hands, then obviously this numbness is going to reduce. And that is why we don't understand whether it is a temporary improper blood circulation or it is a Raynaud's phenomena. Sequence of color changes in the skin may progress from white to blue to red. Occupationally induced Raynaud's phenomena gradually gets worse if workers remain exposed to the condition that caused the problem. As the disorder gets worse, the attack becomes stronger and more frequent. So if you are not going to observe, if you are not sensing that the blood circulation is improper in that particular finger, and if you are going to continue the work, if you are going to continue for that cold exposure, then that Raynaud phenomena may become severe. So it is extremely important to recognize the signs and symptoms in the early stages. One of the workshop, that is Stockholm workshop classification, is often used to rate vibration induced condition. In this classification, vascular, that is blood flow changes, and neural, feeling of touch, heat, cold, etc. changes are considered separately. So some universities, some companies and some researchers are also uh, work on these types of classification. That one classification is vascular, that is blood flow, and second is neural one, that is nothing but the feeling of touch, heat, cold, etc. So such type of classification may be there with different points of view. Attacks of poor blood circulation in the fingers are the most noticeable symptoms of the Raynaud's phenomena. These attacks occur when the hands or the whole body get cold, either at work or at home or from stress, household or leisure activities resulting in cold exposure include washing a car, holding a cold steering wheel of a car, or the cold handlebars of a bicycle. Attack of white finger can also occur when a person is outdoor watching sports or while gardening, fishing, golfing in cold weather. So it is mainly related to the cold weather. If your fingers and hands or toes are touch in the cold part or working in the cold weather, then Raynaud's phenomena may occur. So these are the some signs and symptoms. Typical attacks occur when cold or emotionally upset. Symptoms usually include the cold fingers or the toes. Now, what are the causes of this Raynaud's phenomena? Unfortunately, the exact cause of the Raynaud's phenomena is not known. Raynaud's phenomena affects more women than the men. That is observation. But we don't understand how exactly it happens. Some people have this phenomena for reasons that can't be determined. This is called primary Raynaud's phenomena. So sometimes if you are not even in the cold weather, if you are not in the touch with the cold parts of, that may be a pipe, that may be refrigerant pipes or refrigerant systems, etc. Or even if you are not working with the vibrating machinery, then also it may happen, and that is called as primary Reynolds phenomena. It usually affects both hands equally. People can also get Reynolds phenomena because of certain underlying diseases. So if you are having some diseases like this, then that also affects as a Reynolds phenomena. But we don't understand whether it is a Reynolds phenomena or not. But we can observe some of the improper or impairment of the blood circulation in some of the parts. So if it is the case due to other diseases, if you observe the Reynolds phenomena, then it is called as secondary Reynolds phenomena. Within the workplace, several hazards can cause these secondary Reynolds phenomena. Exposure to the vibration from power tools is the greatest concern. Handheld power tools such as chainsaws, jackhammers, pneumatic rock drillers, chippers can cause hand-arm vibration syndromes. So due to these power tools or some different tools which is giving you the vibrations in your hand, and that is why these hand-arm vibration syndromes can cause a Reynolds phenomena. This disorder is also known as vibration-induced white finger, hand-arm vibration syndromes, or it is also known as HAVS, that is hand-arm vibration syndromes. Occupational origin. So if it is occurring due to the vibration machinery, vibration tools, hand power tools, etc., then it is called as HAVS or vibration induced white finger. Reynolds phenomena, however, is only one aspect of the hand-arm vibration syndrome. Vibration also damages nerves, muscles, bones, and the joints of the hand and arm. If you are continuously working on the vibrating machinery or vibrating power tools, then it may harm or it may damage on a permanent basis to your nerves, muscles, bones, or joints of the hand and arm. Before the cancer causing effects of vinyl chloride were known, workers exposed to the high levels of this chemical often experience Reynolds phenomena. So this vinyl chloride is one of the concern for the cancer. Vinyl chloride also causes breakdown of these bones of these fingertips and other health problems. Reynolds phenomena from vinyl chloride is now an unlikely occurrence in Canada since exposure to this chemical is controlled much better than in the past. So nowadays, Canada, which is the place who were facing this problem of vinyl chloride, now it is controlled. Reynolds phenomena is also seen in typists and professional paintist from the repeated finger stress as well as in the dentist and dental technicians. So the frostbite injury with damage to the blood vessels can also cause Reynolds phenomena. So it is mainly related to the impairing of this blood circulation, and that is why you can observe the examples where this Reynolds phenomenon can occur. So this is the typing activity or it is the activity of the dentist. So you have to use your fingers on a continuous basis. So if you are working for 8 hours or for um, 3 to 4 hours on continuous basis, then you may observe the signs and symptoms of this Reynolds phenomena. A few studies have suggested that gripping a hand tool too tightly could cause Raynaud's phenomena. So this may be one of the cause, gripping a hand tool too tightly. So you have to grip that tool at an optimum level, not too loose and not too tight. Other studies have identified Raynaud's phenomena in workers who injured their hands by using them for hammering or pushing or twisting heavy objects. In these cases, Raynaud's phenomena was part of a disorder called hypoethenar or a hammer syndrome. So this may be a case that is a Reynolds phenomena due to the hammering or pushing or twisting heavy objects. So that may be a one of the cause. So these are the different causes where the Reynolds phenomena may occur. So how long does it take for the Reynolds phenomena to develop? The time between the first contact with the hazardous condition and the appearance of the Reynolds phenomena is known as the latent period. This time varies according to the type of hazard, the amount of exposure, and the individual worker. Some people are more susceptible than the others. So I may feel the Reynolds phenomena after 30 minutes, and some other worker may feel that the same Reynolds phenomena with the same working condition after 20 minutes. So that is also depend on the individual's working capacity and the susceptibility of that particular worker. So the first contact is the main point, and then the hazardous conditions and the latent period, and the time varies according to the type of hazards. So if it is related to or contacted to the refrigerant pipelines which is not insulated, or some of the chemical handling processes, or some of the vibrating machineries, etc., then what exactly that hazard is, and when the first time that hazard is contacted by that worker, and then the individual's capacity. So that these factors are depending or decided the time of that Reynolds phenomena to develop. The latent period for vibration exposure can be as short as 1 year. As a general rule, severe exposure reduces the latent period. If the latent period for a group of workers is short, the disorder tends to appear more frequently. Also, in individual with a short latent period, Reynolds phenomena tends to progress to advanced stages faster. So the main thing is the latent period for vibration exposure can be as short as 1 year. So if you are working in the same exposure, in the cold exposure, or if you are working with the hand arm vibrating machineries or power tools which are generating the vibrations, then the Reynolds phenomena may occur in your fingers or in your hands within the short period or within 1 year. What workers are at risk of Reynolds phenomena? So Reynolds phenomena is primarily a concern for workers who handle vibrating tools or equipment such as pneumatic drills, jackhammers, chipping hammers, riveting tools, impact wrenches, command breakers, gasoline power chainsaws, electric tools, and grinding wheels, especially in pedestal grinders. So we already discussed all these things. These are the vibrating producing machineries, and it is the related case to the workers. Any vibrating tool that cause you a feel of tingling or numbness in your fingers after 5 minutes of continuous use. So if the vibrations are more, then you can feel this numbness or tingling feeling within the 5 minutes of continuous use. Could lead to Raynaud's phenomena, and Raynaud's phenomenon is also seen in typists and professional paintists from the repeated finger stress. So this is the main cause. If your fingers are in a stress on a continuous basis for a longer period, then Raynaud's phenomenon occur in your fingers. What tests are available for this Raynaud's phenomena? How to test this Raynaud's phenomena? Whether I am suffering from this white finger disease or not. Some of these tests measure skin sensitivity or blood flow in the fingers, especially under cooling conditions. So we have to check the skin sensitivity or the blood flow in the cooled condition at lowest temperature. As yet, however, none of these tests is universally accepted for detecting Raynaud's phenomena. So unfortunately, there is no perfect test or certified test which can say that this is the Raynaud's phenomena test. This test, together with careful analysis of an individual's work history and detailed medical history, including signs and symptoms, are useful in the judging if a person has Raynaud's phenomena. So, other tests are often performed to rule out other possible underlying causes. So, you have to check the history of that person's for the blood flow as well as for the skin sensitivity. But these tests are not universally accepted. What treatment is available for this Raynaud's phenomena? Workers with mild cases of vibration-induced Raynaud's phenomena may recover if the hazard that caused it is avoided. For severe cases, prescribed drugs may reduce the attacks. So if it finds initially or at initial level only, then it can be avoided by avoiding the same type of hazard or same type of work. But if it is the severe case, then you have to follow the guidelines by the doctors and you have to consume some of the drugs which is given by the doctors. The aims of the treatment are to reduce the number of and severity of these attacks and to prevent damage to the fingers and toes. When triggers can be identified, an effective therapy is to avoid further exposure to the situation. So that is the main solution to avoid or to treat these types of Raynaud's phenomena, that we have to avoid the same exposure or similar exposure or similar type of work, that is especially vibration work. Extra clothing to maintain body temperature, including warm socks and gloves, are essential to keep feet and hands warm. So if the work is not avoidable, then you can go for the extra clothing to increase the temperature of your body and to avoid this Raynaud's phenomena and to have the proper blood circulation in your body. It is also important to find ways to reduce this stress, as emotional upsets can trigger an attack. So sometimes you can observe the improper blood circulation due to high stresses or anxiety, and that is why we can reduce these stresses to have a proper blood circulation in your body. So these are the some of the guidelines for the treatments. If detected in the early stages, vibration induced Raynaud's phenomena will not worsen as long as there is no further exposure to the vibration. Early cases may actually improve, but advanced cases seldom do. Surgery often reverses Raynaud's phenomena caused by the hypothenar hammer syndromes. So it is a rare case, that is a severe case of this Raynaud's phenomena. How do you live with the Raynaud's phenomena? So some of the precautions can be taken to reduce the number and intensity of these attacks of white fingers. The precautions are: protect the body from cold temperature, dress appropriately for cold weather by wearing layers, mittens, gloves, overcoat, hat and scarf. Avoid exposing your hands to extreme cold. Wear gloves when working in cold water or reaching into a freezer. Protect your hands and feet from injury. Avoid tobacco, nicotine can reduce the blood circulations. So these are some of the protective measures or precautionary measures for the Raynaud's phenomena. Decrease stress and anxiety. We already discussed that. Exercise can increase the circulations. So that is one of the solution, and it is a temporary solution. Exercise regularly and drink plenty of liquids to prevent the dehydrations. During an attack, warm your fingers and toes. Place hands under armpits or make wide circles with your arms. Run warm water over your fingers or soak your feet in a bowl of warm water. So these are the different techniques to warm your fingers and toes. You can adopt that, and in a short time period you can avoid this Raynaud's phenomena and relax. How can Raynaud's phenomena be prevented? So these are the precautionary measures. We have already discussed some of them. To protect the hands from the damage and extreme temperatures, keep warm at work, wear gloves and warm clothing, then massage and exercise your fingers during your breaks. If tingling, numbness, or signs of white fingers develop, promptly consult a physician. Precautions with vibrating tools. So you can go for the anti-vibrating tools, anti-vibration gloves, and anti-vibration shields may help reduce the exposure to the vibrations. So if you can't avoid the vibrating machineries, if you can't avoid the power tools, then you can go for the anti-vibration tools or anti-vibration gloves or anti-vibration shields. In general, grinding machines or vibrating processes should be as fully automated as possible. Workers should use vibrating tools only when necessary. So go for the automation or the robots also. There are several ways to reduce the amounts of vibration that passes from the tool to the hands. Use only well maintained and properly operating tools. Hold vibrating tools as lightly as possible, consistent with the safe work practices, and let the tool to do the work. So try to avoid this vibrating machinery, try to avoid these continuous work on the vibrating machinery, try to opt for the anti-vibrating tools, and try to go for the automations or robotics, etc., to avoid the direct contact with these vibrating tools. These are some of the precautions with vibrating tools. Rest vibrating tools on a support or workpiece as much as possible. Store tools so that they don't have cold handles when next used. Use proper job design with schedule breaks to reduce the exposure to the vibrations. So these breaks also can avoid these Reynolds phenomena, because due to these breaks you can avoid a continuous exposure that may be with the vibrations or that may be with the cold exposure, and automatically your body is trying to control the blood circulation in all types of parts including your fingers or the arms. It is important for worker to recognize if early symptoms and Reynolds phenomena have occurred and then get appropriate advice to reduce the further exposure to the vibrations. Are there any laws or rules, regulations regarding this vibration exposure at work? Unfortunately, there is no rules and regulation in India, but whether these laws or rules and regulations are there in other countries, Canada, British Columbia, and in some of the countries have specifically mentioned vibration exposure within their occupational health and safety regulations in terms of worker health and musculoskeletal defects. Most jurisdictions do not regulate a specific limit to exposure. They are having some exposure limits, but there is no regulation for a specific limit to exposure, but rather state that workplaces must control for vibrations where it can cause health or musculoskeletal effects. So indirectly, some of the countries are having these guidelines rather than the mandatory conditions or the specific limits of the exposure. Rather than that, they are guiding to avoid these vibrations or to avoid this exposure where there are symptoms or signs of musculoskeletal effects or the adverse health effects due to these vibrations or cold weather. ACGH, that is the American Conference of Governmental Industrial Hygienists, has published exposure recommendations for preventions of these hand arms and whole body vibrations. So this is one of the body in America, that is ACGH. Normally they are publishing their or updating their maximum permissible limits of various types of exposures on annual basis, and they are having a stringent norms, but for this case they have recommended and not provided a specific limit, right? So unfortunately there is no law or there is no rules and regulation for vibration exposure at work. So this is regarding about the white fingers disorder, white fingers phenomena or Raynaud's phenomena. Thank you.